here on our stage, on MedTech stage, the first session is a discussion about innovations in Latvian healthcare, the synergy between startups and hospitals in Latvia. Let me make a short introduction. What shall we be talking about? You know, logically, everyone wants a better quality of life. Everyone wants to improve the services and improve the business, and hospitals want to help people and cure people better and better every day. And this, of course, requires an interaction between the academic part, the medical part, the hospital part, and the enterprises which are elaborating innovative solutions in healthcare. How does that work? Last year, in the year 2020, the Health Hub of European Institute of Innovation and Technology in Latvia, which is located at the Riga Stradiņš University, the largest university, medical university in Latvia, they undertook the task of facilitating collaboration between these two worlds, the medical world and the business world, and they also performed a study on this subject. And a brief review of this study, of the results of the study, will be presented to you right now. And this will be followed by a discussion where we have participants representing hospitals and also enterprises. So, ladies and gentlemen, let me introduce our participants of today's first session. First of all, presenter of the topic, Dr. Baiba Pētersone. Baiba, good morning. Dr. Pētersone, she is Director of Department of Academic and International Affairs at Riga Stradiņš University. Then other participants include Sergey Jakimov. Sergey, good morning. How are you today?
Good morning, everyone. Not too bad. Not too bad. How are you?
I'm fine, thank you. Sergey is the co-founder and board member of several enterprises. Let me mention companies like Longenesis, Longe VC, Coatum, Vortex Oil Engineering. Sigvards Krongorns, co-founder and employee of Cast Print and Westcard. Sigvards, good morning.
Good morning.
Hello. Those two gentlemen, as you see, they represent the enterprise part of our discussion. Sandris Petronis, chairman of the board, Riga's second hospital, and also lecturer at the Department of Orthopedics, Riga Stradiņš University. Sigvard, labrīt, good morning.
Good morning, everybody.
And last but not least, Dr. Valts Ābols, chairman of the board, Children's Clinical University Hospital. Good morning, Mr. Ābols.
Morning.
So, everybody here, and I would like to pass the leadership to Baiba now, and she will be presenting results of the study, interactions between Latvian hospitals and enterprises. Dr. Pētersone, the floor is yours.
Thank you very much. Good morning again. Thank you for joining our session this morning. As Juris said, I will commence by a brief presentation on startup in hospital synergy, which will be followed by a moderated discussion. Next slide, please. I'm trying to change it, but it's not working. Okay. So the study was conducted by the National Local Hub of the European Institute of Innovation and Technology. It's a knowledge innovation community called HEALTH. And it is based at Riga Stradiņš University. Next slide, please. So the goal of the study was to explore the current status of collaborations between hospitals and healthcare startups in Latvia. Those are two important stakeholders of EIT Health. So the participants of our study were senior hospital administrators and healthcare startup entrepreneurs. The study had a qualitative component and a quantitative component. And data was collected by a research firm called Berg Research. Next slide, please. So now I will briefly introduce with several of our study's findings. And as we can see from this slide, startup interest in healthcare innovation continues to grow. And this was acknowledged by both hospitals and startups. Next slide, please. The main reason for this enhanced interest in healthcare innovation, as it was acknowledged by both sides, are the overall healthcare and societal trends. And by that, I mean aging population, a demand for a better quality of life, and so forth. Of course, also the impact of the ongoing COVID-19 pandemic, opportunities opening up by new technologies, and also healthcare innovation was perceived as an area that permits to generate profit. In addition to those common reasons, startups identify two additional reasons, and one of them is that more and more financial mechanisms or investments are becoming available for healthcare innovations. And also they said that there is a new generation of scientists who are not just interested in traditional academic careers, but also in developing new commercial solutions. Next slide, please. This slide provides an overview of those healthcare areas that need innovation. And on the left-hand side in blue, we see those areas that are quite well developed currently. Then in the middle, pink-colored bubbles include those that are slow developers. There is some development at the moment, but there is much more to grow. And on the right-hand side, green bubbles, very important, but innovative solutions are currently lacking. Next slide, please. We were also interested in the process of collaboration. And in most instances, we heard that it is startups that approach hospitals with their products or services. On several instances, of course, it was different, but in most cases, it is the startup. And then, of course, the hospital evaluates the quality, legitimacy of the product, makes a decision, and then there is somebody assigned who is responsible about the implementation of the service or application of the product. Next slide, please. Also, our quantitative data showed that startups are proactive. 73 of our research participants on the startup side said that they have approached hospitals over the past 2-3 years. And then on the hospital side, coincidentally, it was the same percentage, but hospitals said, yes, we have been approached by startups. Next slide, please. Here we can see that the percentage is higher for private clinics and hospitals that have been approached by startups, but the difference is not major, only about 10%. In terms of how startups evaluated this collaboration with hospitals, it's quite identical between the private sector hospitals and the state sector hospitals. Slightly over 50% said that it was easy to start collaboration and collaborate. 38 to 40% said that there were certain challenges. And then only a small portion, 7 to 8%, said that it was impossible. Next slide, please. We also inquired about those factors that facilitate collaboration between startups and hospitals. On the startup side, we learned that such personal factors as internal passion, dedication, conviction are very important. You have to believe in your product, you have to believe in your service. Also, expertise was valued very highly, especially in healthcare, medicine, but also in other fields such as product development, sales, marketing. And startups said that it was easier to commence those collaborations if you could prove your legitimacy. You had some sort of external certification, you had attracted third-party funding, you had personal contacts or previous experience at a healthcare institution. On the hospital side, we learned that it was important that there was an innovation-oriented institutional culture, that there was senior clinical staff and senior administrators who supported this innovation-oriented culture. Then we also learned that hospitals said it is important if we have the so-called internal activists, people who facilitate innovation, people who advocate for innovation. Also, experiences acquired abroad were important. And then some hospital representatives said that they were motivated by a possibility to gain a competitive advantage in the form of enhanced institutional reputation, competencies, possibilities for better patient care, and so forth. Next slide, please. So I discussed facilitating factors. Now this slide gives an overview of a couple of barriers. Both parties said that hospitals occasionally lacked medical personnel, or medical personnel was overworked. There were bureaucratic obstacles, a lack of governmental support. In addition, startups also noticed that sometimes at some healthcare institutions, the decision-making process was not as fast as they wished. They also encountered difficulties in attracting funding, and they also acknowledged that sometimes they lacked knowledge about healthcare systems and hospitals in particular. And on the hospital side, of course, no surprise, hospitals have been heavily affected by the ongoing COVID-19 pandemic. They also acknowledge incomplete national legislation. And then also on several occasions, they noticed that some startups did not have sufficient knowledge about healthcare. Next slide, please. Then we also asked about hospital gains from collaborations with startups. And here we see that the leading gains included enhanced patient care, workload relief for highly qualified medical professionals, enhanced competencies, and then to a lesser extent, additional motivation for clinicians, balanced workload for clinicians, positive institutional reputation, and also the possibility to develop and strengthen research centers at hospitals. Here we also inquired about the startups' perceptions, and we can see a couple of places where the opinions diverged, and those are circled in red, especially about additional motivation for clinicians, workload balance, and the importance of research centers. Next slide, please. And then finally, we asked our participants to suggest ways that this collaboration can be enhanced in the future. Both parties agreed that an interactive online platform is important, and they also discussed the importance of having a new accelerator that is specifically dedicated to healthcare. And of course, they also acknowledge the importance of an ongoing information exchanges between hospitals and entrepreneurs. And then we can see that there are certain factors regarding which opinions diverged again. And one of those was a need for formalized requirements to evaluate startup qualifications, also about the need for interactive working sessions on specific healthcare issues, and then on the importance of a designated innovation unit at hospitals. Next slide, please. So I have completed my presentation. Thank you. If you want to learn more details about our study or get in touch with us, this is our email. And now I will give the floor to Mr. Steinbergs. Thank you again.
Thank you, Baiba. Thanks a lot. May I ask a question? In this study, did you approach also private hospitals? They were mentioned in the presentation, but mainly the data is based on information gathered from states hospitals, right?
No, not necessarily. We approach both kinds of hospitals, and not just large hospitals in Riga or hospitals located in Riga, but we are also very interested in regional hospitals as well. So it is a mix.
It's a mix. Okay, thank you. I'm asking because I've got the idea that the situation might differ quite significantly between the private sector and the state sector, because of legislation. I think private hospitals, being private companies, if they decide to introduce any new technologies, innovations in their daily work, and they can do it just like this. We want to sign a contract with a company, and if we think it's valuable for us, we can do it. In the state sector, it's slightly more difficult because everything must go through the process of tenders, right? Am I right or am I wrong? I would like to ask Dr. Petronis, what do you say about this situation?
I can comment that also for the private hospitals, there is legislation which should be followed. And for sure, for decision making, maybe sometimes it's easier to make decisions because the owners or the board of the company can make it easier in compared to the state hospitals. But I would suggest that the potential for the the scientific potential is bigger for the state hospital, because usually in state hospitals, especially who are involved in work with universities, who work with the students, residents, they have a big experience with scientific development, scientific projects. And this is a positive benefit in state hospitals.
Dr. Ābols, how is it in the children's hospital?
Well, I would not see the difference of or any significant barriers. I think the key element driving the innovation is a willingness to innovate, and if the management or the hospital environment or hospital culture supports that, so I don't think there are specific barriers which wouldn't allow the state hospitals to be in that game.
Mm-hmm. In the presentation, there was a slide where those areas where the level of innovation is sufficient, where on the left side and on the right side there was a bubble of different other areas where this field is really undeveloped in Latvia. And to my big surprise, if I caught it right, then those undeveloped fields, where almost all of them were connected with information technologies, right? Am I right or am I wrong? And if yes, why is it so? And what are the main areas in the healthcare that really need more innovations? Again, if I could ask all of you, I see that Sigvards is raising hand.
Yeah. So thank you for having me today. And yeah, I actually saw that first and foremost, in one of the areas which needs and significantly improved, and also we actually as a startup Casper and see every day, is acute rehabilitation, which is unfortunately actually non-existent in healthcare. meaning that in cases, let's say, for example, real-life cases post-stroke, where there are potential cases, well, basically, there are needs for assistive devices for a patient to actually receive them on time actually is impossible because they have to go through the process through the Ministry of Welfare and so on. So this is a significant part because once actually, and this maybe also both hospital representatives can already comment that for people to actually receive rehabilitation as soon as possible is crucial. That actually afterwards is actually being treated as soon as possible, thus actually increasing the outcome as well.
Dr. Petronis, any comments on that?
I would comment that it could differ from hospital to hospital. At least in our hospital, it's possible to have rehabilitation as soon as possible, also in hospital and also as an outpatient.
If I look at the slide now, I see that those areas which lack innovative solutions, I see unified IT system for doctors, electronic health, patient flow management, internal system integration, patient data transfer. This is all more or less, as I said, connected with IT solutions. Any ideas why? Dr. Ābols, what do you say?
Well, it was interesting to see the evaluations for this, from the study participants, and especially the fields where you would expect innovation / digitalization to be really at the forefront. And these are the ones you mentioned, like electronic health data and image exchange, system integration, data accessibility, patient flow management. Those were identified really as ones lacking the innovative solutions. And all those mentioned are very closely related to the healthcare data. And in healthcare, we have really every opportunity to collect massive amounts of data. So the challenge is how we leverage these data. And the statistics says that up to 1/3 of world's stored data are from the healthcare. And every single patient generates nearly 80 megabytes of new data per year in electronic health records or imaging. But at the same time, it's estimated that up to 80% of health data remains unstructured and unused after collection. So we're talking about the health data silos, which really prevent potential users, being it clinicians, being it researchers, authorities, industry, from analyzing and applying the essential information for the improvement decisions. So the healthcare data really are only valuable if these in some way serve the patients. So, and we do have many unresolved issues in our system, but that data silo is one of the problems. And we collect data everywhere, starting from the bedside. We collect genetic information, clinical, imaging, public health data, etc., etc. But we log them in a separate units, like hospitals, clinics, agencies. And these are data, and these data are not communicating between themselves. And this leads to fragmentation of the care and also to disintegration of the patient pathway. Then poor outcomes, but also kind of prevents our ability to use them for a secondary analysis and for innovation. And in a current and future medicine, I think the data-enriched and data-driven approaches and technologies are the ones which kind of drive the innovation and leads us to the state where better disease prevention, personalized medicine, any solutions comes faster, and the new and advanced therapies becomes possible. So, for example, we could use more data-driven technologies such as artificial intelligence to help diagnose the diseases or conditions, or to gain better insights into treatment and prevention that could not be that couldn't be developed otherwise. So we could use robotics or whatever, the voice assistants to support people, and well, the rehabilitation was mentioned. So this is huge potential area where we could use data for innovations in this area, or dementia, or some other things. So what I want to say that basically what we see is that the unmet medical need is really huge, and therefore speeding up like that data processing will speed up also innovation. And I was surprised to see that those green bubbles were mostly related to our ability to process data.
Yep. Mr. Jakimov, could companies like Longenesis or similar be of any help in that situation? Or maybe you already have positive experience in this field, collaborating with hospitals?
We certainly do have positive experience in the field collaborating with hospitals, yes. I also think that Valts here represents one of the most splendid examples in the Baltics of how hospital has actually digitized its data repositories, and how hospital can be ready for using and utilizing any sort of biomedical data assets for research and unlocking them for research. On the broader scale, to be completely honest with you, it is an a lot of years old question, about how do we standardize data and how do we achieve what you call data interoperability, right? And that is something that Gates Foundation, I think, has identified as a $1 trillion problem of our century. Well, mostly because of the fact that when you were talking about data interoperability, you're essentially talking about two phenomena, right? So one is technical interoperability, which means that how do we achieve a very simple yet almost impossible sometimes task of multiple IT systems in one hospital, data harvesting systems in one hospital, actually communicating to one another, right? There are some hospitals that have achieved that. There are plenty of healthcare institutions that are very far from it. And then the second one is semantic interoperability, right? And this is where we're lagging behind tremendously. And this is where we have a lot of data, yes, but we do not interoperate these data items in order to actually, get something meaningful out of it, right? So getting back to our example at Longenesis, and this is me now wearing my startup hat, not the venture fund hat. We have actually attempted and offered our own approach of how to unlock and show the data to the outer world that is there in the hospital without actually compromising the privacy and security, and keeping the data local, which is the future of data research, keeping the data local, not ingesting it. And then at the same time, giving the hospitals the ability locally to locally onboard and to locally engage participants in the actual research, because data is only where it starts, right? We use data as pointers. What is interesting is using data and then essentially using it to identify the human beings behind and enrolling these human beings, the patients, into the study in order to generate new data, in order to generate real world evidence, right? And this is where the value actually is. So in Latvia, we have had very positive experience actually collaborating with the Children's Hospital here, and we're continuing doing so. And we actually think that this will be one of the hopefully will be one of the landmark examples in the next half a year of how we bring innovation and bring data utilization here in Latvia.
Have you approached other hospitals too?
We have. We also have had and still having collaboration with Riga Strategic Hospital, for example, right? Because the concept behind Longenesis is essentially enabling clinical institutions non-invasively showcase and unlock their data for research in a way, right? Keeping the data local, which is fairly unique again as an approach. So we have been working, apart from Riga Strategic, we have been working with the other clinical centers here in the area as well, right? But what we are seeing is different levels of digitalization, right? And that is, I wouldn't say it's an issue, it's a challenge, And it is mostly, well, due to the fact that hospitals already have some sort of an IT system legacy that is there, right? Because they have been developing their IT systems consequently for the last 20 years. And that has created, a pile of systems that essentially don't communicate to each other. In some cases, we see better organization and we see better digitalization. So, we don't see the common pattern. So essentially here in the Baltics, you need to adjust case by case in terms of the readiness of the institution to actually unlock the data.
Okay. Mr. Krongorns, any good examples of collaboration with hospitals by Castprint and Westcast?
Yeah, of course. So with Castprint, we have been successfully collaborating, mostly, unfortunately, still with the private sector and private clinics, because with Castprint's case, the challenge is usually, so you can see in the background here is Castprint Cast, and the challenge is usually because state hospitals are state-owned, thus they offer state services. And the challenge usually is, well, can they offer and at what capacity they can offer the so-called private additional services? The challenge was usually understanding the implications that with hospitals, again, their own processes, their own systems, and their own, let's say, challenges, seeing that, for example, you have many patients all the time and so forth and so on. And with Castprint, you require an additional one visit. So this is a challenge. And at the same time, we have already successfully also initially collaborated with Second Hospital, with Dr. Petronis, providing us valuable feedback initially, understanding what are the challenges and how can we improve our service as well. At the same time, as well as doctors from Children's Hospital are still also recommending Castprint as well, right? Now the challenge is it's still available, for example, with Children's Hospital in the Gailzers Hospital where the surgeon is located. At the same time, we're still looking forward always to collaborate even more in the future.
Thank you. How is this process of dealing with innovations organized in hospitals? I would like to ask Dr. Petronis, for example, in the Riga Second Hospital. Is it a kind of a passive sitting and waiting when the businessmen will approach you and offer their services, or do you have any department of innovations or a section of innovations or maybe a person responsible for these contacts?
We also are waiting for sure for innovations which are coming from the industry, especially big innovations comes from the big international players who has new technologies, and our hospital, for example, uses already for several years. We started first in the Baltics a system which is called Orthopilot, which is computer system which assists for us to put inside the implants in the hips and knees more precisely than conventional surgery technique. And if we speak about the hospital itself, then we don't have a separate department which works with innovations, but each department is also looking in a way of innovations, and then usually people who are very interested in and who has a motivation to work with innovation, then these people are assigned to work more deeply.
And Children's Hospital, have you any system for dealing with innovations?
Well, yes, we are very positive towards innovations, and innovation management really lies in the heart of any progressive organization. So basically, the healthcare sector is too large field for innovation to keep it strictly in-house, and therefore the open innovation model is something that we are currently ready for. And that means the collaboration with the industry and the third parties in really solving the challenges of the healthcare sector. And that can significantly speed up that progress of innovation. So what we currently are doing, and we are in the process to establish the new structure in the hospital, inside the hospital. That will be the so-called Center for Advancements in Healthcare. Now, the Center for Advancements in Healthcare will comprise several building blocks. One is covering research and development. The second is education and training, including all type of the simulations and knowledge transfer for professionals, etc. And the third block is really the innovations. If we talk the innovations, that center will serve, if I may say, as an open to all test bed, and that will be the purpose will be to test. To serve as a test environment for academia, for industry, for startups, to validate whatever solutions, devices, or services. And it is a consecutive unit for research and development where companies can study their clinical processes and try out their solutions with the support of our staff and patients. And the testbed will be open to basically to all environment and service, and will serve as a really the trial facility to anybody, and that will allow more actors to participate in the healthcare advancement. And we believe that testbed will enable education, also the surveying and research collaboration, and that basically the underlying goal of this testbed is to create it as supportive and resourceful environment for companies and professionals, for everybody willing to innovate and improve. So I'm looking forward in a very soon future to have it here.
Yeah. A couple of years ago, I remember, I don't remember exact numbers, but I saw a picture where the number of emerging startup companies in Estonia and Latvia were shown. And to my big surprise, Estonians had a lot more new companies emerging every year, especially in the field of healthcare. Do you have any knowledge about, has this changed, or it's still the same? And if yes, then what could be the reason if we compare these two Baltic states? Who might know anything about this? Mr. Krongorns, maybe you?
Yeah, I can actually. So the good news is that we are, as a medical community, as a startup medical community, are growing. So I think a couple of weeks ago, there was already an article published that are already more than 20 startups that are already in more than development, actually, in the healthcare field in Latvia. But so replying to you regarding the question is comparing with our Estonian neighbors, naturally, because and this is not just purely healthcare, but startup system and ecosystem as a whole is much more developed there. So thus they have more resources and they have been actually historically more successful and thus bringing more startups to the market. But I think actually, and the hope is that we are slowly but steadily also growing as well at our own pace. And I think there is a lot of opportunities still to grow as well.
But what might be the reason? Why, I mean, practically, why? Because the numbers were quite astonishing. You said in Latvia we have now around 20 startup companies. Yeah, but 20 is almost nothing to compare with several, let's say hundreds almost in Estonia. So is it the state support? Is it the matter of legislation, or what's the reason?
So from personal experience, the first and foremost is that historical side. So that basically we haven't had that many successful startups or in healthcare and technology that actually have gone before, right? So again, in order to be and to develop new entrepreneurs, we need to have these examples actually how to do it and how to succeed, right? So this is one of the things, historically speaking. And secondly, you can always talk about government support, but actually I would say the private sector, particularly the private funding and private financing options are not that big comparing with Estonia, again, due to their historical success. So these, I would say these are the two main issues why, for example, we are still lagging behind.
Well, I've heard an opinion that, okay, Latvia is a small country and also the healthcare market here is quite limited and maybe it's not worth to invest energy, knowledge and money in a startup in the field of healthcare just because of the size of the market. But as to your companies, and that's a question also to Mr. Jakimov, you are not concentrating only on the local market, right? You are just looking much wider for customers outside of our country too, right, Mr. Jakimov?
That is absolutely correct. Let me circle back first to your question about Estonia. I normally abstain from comparing Latvia to Estonia in any context, right? It is a very again old discussion which I don't normally like. But let me put us down to earth a bit. In order to co-found or in order to launch a startup, you need money, okay? So you need liquidity. And that liquidity should be invested by someone, right? And that someone is normally your venture capital ecosystem. Founding a startup with governmental grants is close to impossible because startups are very fast-moving beasts that are born fast and they die fast as well if the money dries out. Right, so essentially you need to be invested by the capital, which is easily movable around and easily utilizable to actually grow the company, hire people, conquer new markets. So that's one. The other one is we would, as longevity, right? So as a venture fund, for example, we would never invest in a startup that would approach us saying, our major market is Latvia. We would never invest in a startup which would approach us saying our major market is Baltics, right? Baltics and Latvia are tremendously good, and I'm actually quite sure about it, as beachhead markets, as a place to start, as a place to validate your value proposition, because the industry is accepting innovation, as the colleagues or our colleagues already have mentioned right before. And B, the soul scale of the society is not that big, right? So it's basically everything is arm's length from you, and you can talk to stakeholders directly. That said, all startups have an ambition to actually go global, and they would not be capable of raising any money if they wouldn't have this ambition, right? So they would not be existing in the very first place. So I think the reasons are very, very, very down to earth and very material. It's the availability of capital. And something, just reverting sort of back to what Valts said, right? It is actually very important and it is very welcome to have a sandbox approach in the clinic where you can actually invite startups to validate their value propositions and to validate their solutions, right? Because that is pretty much existentially important for the companies, essentially in the early stages.
Do the hospitals have examples of such sandbox approaches? Not necessarily with local startups, maybe even some ideas from other countries. May I ask the Children's Hospital, for example?
Clearly yes, and okay, that's a longer discussion. But currently, the Children's Hospital has initiated a pretty ambitious project, which is called Children's Health Ecosystem, and that's like a strategic initiative of our hospital towards digitally enabled, integrated, patient-centered solution to improve the children's health and well-being. And we're talking about, digital health solutions to help to connect virtually every aspect of health and in such a way expand digital health ecosystem for children. We will support more informed health decisions and also reach out to more people. But there are several elements in that ecosystem, and one of them is, as we call it, digital research environment or digital data lake. And it is well known that the digital health is a link between the data science and the healthcare. And we, as a children's hospital, are the ones with full electronic medical data, and we are aiming to build that digital research environment in a hospital, and that will harness really that powerful combination of data with the data science and innovation, and that will boost the healthcare advancements. So basically allowing the data for secondary use, and that kind of provides limitless opportunities for really machine learning and deep learning, artificial intelligence, etc. So I think that there are good examples around the world. We are part of the European Children Hospital Organization. So some of our partners, like Great Ormond Street Hospital in London, Helsinki University Hospital, have introduced this kind of approach, and that's a way how they boost the innovation and attract innovators to the hospital.
Anyone would like to comment on that or add anything? Mr. Krongorns?
I can add. So one of the, I would say, benefits of having such a smart and small community is that with collaborating with startups, hospitals, in our opinion, can actually significantly influence the level of the service they actually want to receive and how they receive it. So very specific to them. And thus, actually, for example, comparing with, let's say, taking an existing solution already from the outside world, then you would have to adapt to that service. So in this case, collaborating with startups is, in our case, it looks like more beneficial because you can actually significantly influence the outcome, actually, and how do you actually want to receive it.
We've got a couple of more minutes left. I would like to ask you, what do you think about the future trends in healthcare innovations in Latvia, both from the point of view of startups and the medical community, the hospitals? I'd like to ask Dr. Petronis as the first. Your mic should be switched on, Doctor.
For sure, in the future, we are looking for improving our digital systems and also for the data exchange between these digital systems. Also, we look in the future very practically. In our field, in trauma and orthopedics, we look in the field of new implants and also new biomaterials, where we have a good experience in collaboration with universities, with Riga Stradiņš University and also Riga Technical University. We have good results. So we look at this collaboration between the hospitals, universities, and also government should be involved, because the strategy in the country itself and the politics also has influence on the development of hospitals and also development of innovations as well. Thank you.
Thank you. I really hope that somebody involved in let's say, in healthcare in the future, and somebody with a mindset of a businessman is listening to this part of the conference now, because I'm asking the same question to all the other participants. The future trends, the future needs of the hospital world, Children's Hospital. Dr. Ābols, your turn.
Okay, thank you. As I said, so the unmet medical need is very huge. But in terms of the opportunities, I would put them in like let's say four buckets. So one is everything around like a data-driven hospital, data-driven healthcare in general. And the second is like integrated care pathways. So bringing everything around what's happened to the patient in like an integrated chain. So the third thing is everything around the personalization. So we are not treating on a population level, but we are more and more treating individually. And the fourth thing is really empowerment of the patients. So engaging them into everything around their health and well-being. So as an example of data-driven hospital, let's say that everything in a data-driven hospital, we would allow the new knowledge to be captured as an integral, really byproduct of healthcare delivery. For example, as I said, we are continuously collecting the data, and let's say electronic health record contains really rich clinical information, and if used, that can serve as really opportunity to design like decision support tools, like new algorithms, which then becomes a part of the next generation electronic health record. So that's one. So integrated care pathway, that will depend on really ultra connectivity. So seamlessly accessing data and interoperability of the systems. So basically that will integrate all of the treatment pathway and care pathway, and huge opportunities for innovation. If we talk about personalization, that represents really a leading driver of the health data economy, in which the healthcare recommendations can be individually tailored on the basis of different information, being genes, lifestyle, environment, whatever you name it. And finally, empowerment. So wearable technologies and apps engage patients in tracking their own health and manage their own health. But also we can use that for care teams that could continuously monitor patients' conditions, and by gathering that information also provide timely alerts or suggest interventions on a personalized manner. So there are huge opportunities, if I may say so, for the innovation coming from those 4 blocks.
Thank you. And again, as I said, I really hope that people, the future businessmen, are hearing this, and they can then build their ideas according to what they are learning today. We are out of time. I would like to ask some more questions to our businessmen, but unfortunately I cannot. We have to finish this discussion. Mr. Jakimov, sorry for spelling incorrectly the name of Longenesis. I did it incorrectly yesterday.
It's all right. It's all right.
I apologize.
Every attempt counts.
Yep. And I thank you so much, gentlemen, and also I thank Dr. Baiba Pētersone for participating in this discussion. And gentlemen, have a nice